Good morning. This video is one of the first videos for the course of the Alternative Medicine College of Canada set of video courses. And this course will focus on the first visit. Why we'll be discussing the first visit in the context of a naturopathic practice, an add-on to the following course modules called F122, F131, and F214, which cover the topics of hygienic principles of health, the pillars of health, and medication tests and emergencies. So this video serves as an add-on to the course material, which will be found in your printed course manuals, so that you understand how the different topics covered actually come together in the naturopathic office practice. This is our agenda for the next hour. We will be talking about the purpose of the first visit with your client, guidelines as to what to ask your client in the first visit and how to conduct that first visit, how to uncover obstacles to cure in your patient's life. We'll also discuss certain basic red medical flags and what you can do to make an appropriate referral. And we'll end by talking a little bit about charting, which is also an important part of first and follow-up visits in general. So the first visit is basically the first time that you meet your client when they come to your alternative medicine practice for the first time. Generally, the first visit lasts anywhere from an hour to an hour and a half, depending on practitioners, which is much longer, obviously, than first visits in the conventional medical setting. And that's simply because we're not simply focusing on physical health, but we're also trying to find out a lot more about what is going on in your client or patient's life, and also eliciting more details about the chief complaint and associated complaints. The first visit is really important because obviously this will be the first time that your client meets you, so you want them to have a good impression and you want to try to establish good rapport from the start. Good rapport is really important because not only does it make your client feel comfortable so that they want to share information with you and they will open up to you regarding elements that may be very pertinent to their health, but also the better rapport you have with your client, the more likely you are to have them clarify when they have questions, when they're unsure about something. They might also open up to you if they're unhappy about their work with you. All of that in a way that is quite polite and courteous. There is research that shows that clients are much more likely to sue you and undertake some legal action if they do not have good rapport with you, if they feel like they cannot trust you, or they don't feel supported in their work with you. So these are all very good reasons to establish good rapport from the get-go with your client. The first visit is also important because the client will share with you why they're here, and you will be able to clarify with them why exactly they've come to visit you. They might have different types of health complaints that they will share with you during the intake, and they may have a chief complaint that is perhaps not as severe or that doesn't need to be taken care of as urgently as other health complaints that they might have. So as their practitioner, the first visit is also an opportunity for you to prioritize with them, or to let them know that perhaps another blood test is necessary. Basically to have that discussion with them to make sure that you're on the same page as to what you will be doing together. During the intake, you will be asking them lots of questions, and the goal of that is also to rule out any medical red flags, meaning any kind of symptom that they might present with that would lead them to seek conventional medical care and not be sitting in the office with you, alternative practitioner. We'll talk more about this later. In addition, you want to ask your client about other interventions they might have already tried. For instance, have they sought help from a homeopath, from an osteopath? Have they done traditional Chinese medicine? Are they seeing a psychotherapist? Maybe they've already done some other conventional interventions, like they've seen a dermatologist or other specialist. It's important to know all of this information because there may be things that they have already tried that were also located in your toolkit. And so you then know that those interventions have not worked so far. Ideally, your client will have brought to you any existing blood test or other medical report they might have done, and these basically are more clues for you to understand what's going on, and also to rule out anything that may be on your radar at this point. So, for instance, if a client is complaining of shortness of breath and fatigue, maybe you're thinking they have some iron deficiency anemia, and so you would like to see a blood test to establish what their iron status is and are they or not anemic. So if they brought that blood test to you already, then you can rule this out of your list of potential diagnoses. At times they will come to you with blood tests, but maybe you do want to rule out anemia, but there was no iron status previously done on their blood test. This might happen if, for instance, they bring you blood test results from a previous annual screening, which generally will cover things like fasting blood sugar levels, cholesterol, blood pressure, but there may not be a direct measurement of their vitamin B12 or iron status, and you might want to see this. So this is when you would ask your client to visit a general practitioner again and get that blood test done. And of course, the most important part of the first visit is to ask them enough questions to uncover what is the root cause, what has created their current health complaints, because it is only once you know what the root cause is that you can successfully establish treatment. So the first visit has many different purposes, all of which are quite important. And so it's important to really structure that time together with your client to make sure that you cover everything. When your client first walks into your office clinic or clinic, you want to set the tone. So in the first visit, what your job is to provide a safe space for your client to open up. So you are the one who will set that tone initially by first perhaps introducing yourself and just explaining briefly to your client what the next hour will look like. Remember that your client may have never been to see an alternative practitioner before, so if all they're used to is their standard medical visits, clients are, so to speak, trained to speak to their GPs. They are trained to only have 8 to 10 minutes with their GP and to really only talk about the bare bones physical complaint. You want to show them that a visit with a naturopath or with another alternative practitioner is very, very different from that, and that you're essentially interested in all factors that may be potentially affecting their health on every level. So typically what I will say is something like this. The first visit will last about an hour. During that time, I will ask, of course, why you're here today, and we'll discuss your chief complaint in detail. But I will also ask you broader questions about other factors affecting your health, like your diet, your stress levels, your past medical history, your family history. And usually I might end with a joke and I might say something like, basically, it's a lot of questions for you today. Something to make them feel comfortable, but also to explain to them why you will be asking all the questions that you will be asking, and that it's essentially very different from the medical visit that they might have had so far. So the idea is for you to come across as something to whom they can open up, and you want them to be a person in their environment that they can rely on and trust, ideally. Sometimes in the first few minutes you will see that some heavy topics are brought forward, so there you want to really follow your patient's lead. So if they immediately start bursting into tears and discussing their depression or the grief that they're having over something or their history of anxiety and depression, and they obviously feel comfortable with this, you can follow their lead and immediately go into the meat and potatoes, so to speak, of those heavy topics. However, if you feel like they're a little bit more guarded, but maybe on their intake form they've indicated that there are some heavy topics to be discussed, like an abortion, death of a loved one, a traumatic intervention, then you obviously don't want to immediately start questioning them about that, but start with lighter topics, other chief complaints that they might have mentioned on their form, perhaps their skin problem, their colds and flus, and just gradually let them warm up to you before questioning them about those more difficult topics to discuss. In the first visit, Your goal is also to find out as much as you can about the chief complaint and any other associated complaints. So, the way to find out more about the chief complaint is essentially ask them a lot of questions. So, these are general questions that will pertain to the chief complaint. So, let's say, for the sake of example, that they tell you that they are coming for their frequent headaches, and that is the reason for their visit. So, you will ask more about the nature of the headache, which would be the what or where. Where is the headache located? Is it more of the vertex of the head? Is it closer to the temporal area? Or maybe they'll say it starts in the nape of their neck and then radiates upwards towards the vertex. You want to ask, what about the headache? Can they tell you more? Is it a throbbing headache? Does it feel like a vice? Maybe they've noticed that it's associated with them feeling very nauseous, or perhaps it starts when they've been very tired or angry. And obviously, you want to find out when has it started. Generally speaking, the more entrenched health problem, the longer it will take to resolve. So if they tell you that the headache started last year when they started this stressful new job, chances are it'll be easier to resolve than if they tell you they've had this menstrual headache in the last 20 years since they've started menstruating, for instance. So knowing the onset of the symptom is always a very good clue as to the prognosis, and you can then manage your patient's expectations. Some people come to the naturopathic clinic with very realistic expectations. Others have tried everything before they've come to you. They're really fed up, and they think that you will be the miracle cure. So they might come in saying, I've had a headache for the last 20 years. I've tried Panadol. I've tried acupuncture. I've tried chiropractor. And they're just very, very impatient. So you will get a sense for that. And in that first visit, you will be able to educate them about how long it might take. So you might say, if you've had it for 20 years, that means that your body is very used to creating this symptom, and it will take some time for your body to start doing something new. There's a certain amount of patience that's required. So that first visit is also a very good time to educate your clients and set those expectations, and also assess where they are on that spectrum of impatient versus empowered versus victimized by their health problem. And that will also dictate your attitude towards that client. Obviously, people are very, very different when it comes to that. So once you've asked everything that you can ask about the chief complaint, what you want to do is zoom out slightly and learn more about the context of the chief complaint. So that's when you want to tell your client, okay, that's great. I understand you've come here for your headaches. Maybe you can tell me a little bit more about your diet now. When people come to see a naturopath, they usually expect that they will be asked about their diet. So they're generally very open to that. Okay? Once you're done asking about diet, then you move on to asking more about exercise and stress, and then more about their family and personal medical history. And always ask them, what else are they taking? So regarding their diet, that is usually where I start when I zoom out from the chief complaint, because it's generally quite an easy topic to broach with clients. I will ask them to give me an outlook of their daily diet. So I will say, can you maybe give me an idea of what you're having at your breakfast, lunch, and dinner in a normal, typical day? So they will tell me, well, for breakfast they're having cereal with milk and a coffee, and for lunch they go out and have a salad, and for dinner it's at home and they have noodle and steak, something like that. Or that might give your client an opportunity to say, actually, I travel for work a lot and I'm really only home 50% of the month, and in that time I will eat this and that, but when I'm traveling I'm mostly eating in Chinese restaurants or something else of that nature. You definitely want to ask them about their coffee, alcohol, and soda sugar intake in general. People, you will notice, will generally minimize the amount of coffee, alcohol, and sugar they have in their diet, so you may need to probe around a little bit. And also make sure to inquire, are there certain foods that they're already actively avoiding? So are they vegetarian? Maybe they're very health conscious and they've already been gluten free for some time. Maybe they've realized that eggs make them feel really bloated and they've been avoiding those. You want to know this because food intolerances and reactions to foods are very, very real. And sometimes when the client tells you that they've had a tummy ache and they've been bloated, maybe you immediately think, oh, well, maybe they need to go gluten free. And then they tell you they've already been gluten free for 15 years or something along those lines. So for you, that might eliminate an avenue for treatment, and also eliminate a possibility as to what the root cause is. So these are very important questions when it comes to diet. You definitely want to find out what medications are they taking. So anything prescription is obviously crucial, but sometimes people also take a great deal of over-the-counter medication. Like, do they take a Panadol every day for their headache? Are they on prescription painkillers for their painful periods every month, right? Are they taking decongestants every night because their nose is congested? These are important questions to ask because A, you can educate them about potential side effects of taking those items in the long run. So, for example, if your client is taking aspirin every day and they have heartburn or gastric pains, this may be a very real side effect of daily aspirin use, that they can develop an ulcer, right? Or if they're taking prescription laxatives every day, this might create an addiction, making it very difficult to stop. Or maybe they're using steroid creams for their eczema every day, and you want to let them know that in the long term that can thin their skin and actually create some withdrawal symptoms. So they may not know all of these things, and you want to educate them about that. Make sure you question them specifically about the usage of oral contraceptives and analgesics like Panadol, ibuprofen, or aspirin, because many people, in their minds, they do not consider these drugs as drugs. So you'll ask, is there any medications that you're taking? And they'll say no. And then you'll ask, are you on the birth control pill? And they say, oh, yeah, I've been taking that for 15 years. Or you'll say, are you taking any medications? And they'll say no. And then you say, you find out they have headaches and you ask them, or joint pain, and you ask them, are you taking any painkillers for that? Oh, yeah, I need to take a paracetamol 3 to 4 times a week for my knee pain, right? So you need to be a little bit specific about those things and obviously ask them, how long have they been taking those items? It's a very different story if a person has been taking paracetamol for the last 2 weeks for their headache versus for the last 10 years for their headache, right? Again, this will give you an idea of what the prognosis might be, and you may need to have a very real conversation about the fact that they need to visit their prescribing practitioner and perhaps start weaning off that drug because it's just too much. This happens a lot with acid inhibitors like Zantac or Nexium, where people have been prescribed some sort of acid inhibiting drug for their stomach when they went to the GP or gastroenterologist for gastric pains, and they were essentially never removed from that prescription. So it keeps on being refilled, and there's no medical practitioner really aware of that. And that can obviously create a negative situation for the patient. So sometimes, you will be the sole person who knows exactly everything that they're taking, and it is your chance to educate them before they do any permanent damage to their body. You also need to ask about other supplements because there's a great variety of people out there. Some people will come to you and they're afraid of taking natural things, and others will come to you with a list of 30 supplements that they've been taking religiously for the last 10 years, and that is also your chance to educate them about that and hopefully remove some of the agents that they're taking, and also analyze the long laundry list of items they may be taking and check for any interactions. So you are asking these questions for a reason. So while you're asking these questions, the analysis is running at the back of your mind. You want to find out more about their personal medical history because, again, if they have been hospitalized and had surgeries, maybe recovery will be more difficult when it comes to their chief complaint, right? Or if they have a chronic congenital illness, then certain things you may not be able to fully correct. Same with their family history, although your genes do not determine your fate. If they come from a heavily diabetic family or a family with a lot of heart disease or cancer, um, this may be a drive for them, a motivator as to why they have now visited you to for you to help them look after their health. So these are important things because they can act as levers, things that you can use to motivate them in the future. And finally, you keep on taking that step back by asking them more about their lifestyle. Okay? Lifestyle means their stress levels. A good question to ask can be, especially for those that may have difficulty describing how they're feeling inside, would be if you were to give a grade to your stress levels between 0 and 10, 10 being the most stressed you've ever been, and 0 being the best holiday you've ever had, where would you place your stress levels currently? And you will be surprised, so many people will rate their stress levels are 8, 9, or 10. Okay, so that will obviously represent an obstacle to cure. Sleep is also very important, and sometimes all people need to hear is that they need more sleep. So you might ask them questions about their sleep, like what is their usual bedtime? When do they typically wake up? Do they fall asleep easily? Do they toss and turn? Do they wake up at night? Some people have slept, but they wake up feeling like they haven't slept because their sleep was so light all night. Some people have vivid dreams and nightmares, and they wake up from them. So you will need to question them in a little more detail if you feel like there's information there. Obviously, exercise is important. You know, so many people come to me complaining of muscle stiffness because they simply sit all day long, and all they need really is to move a little bit more. And environmental exposure means any toxic exposure that they might have in their everyday life. So already if they live in a large city, they will be exposed to fumes and so on. If they've traveled a lot, maybe they've been exposed to contaminated drinking water. Maybe they have a higher likelihood of having caught an intestinal parasite. I always ask them about their dental health and whether they have any dental fillings, because unfortunately, these old amalgam fillings contain mercury, and many people will have a high mercury body burden without really knowing it. Okay, so these are the basic questions to ask. You may want to include at the end of this questioning a short review of systems, which essentially means just quickly going over other body parts from the top down, so starting with hair and head, nose, eyes, dental health, moving down to digestive, cardiovascular, kidney, urinary health, skin health, joint muscles, just to do a quick checklist just to see if there's anything else that might be important. Because remember, as alternative practitioners, we're trying not to think only linearly, but to have a more global view of what's going on with the clients. Um, so, for instance, if a client tells me that they experience heart palpitations, they're a female client in their 50s, their menstrual cycles are becoming lighter or less regular, they wake up at night with some anxiety. All of these are little clues that emanate from different body systems, which will help me make a diagnosis that she's probably undergoing perimenopause and how can I best support her through lifestyle, herbs, and diets. Okay, so this is an example for you to understand why we're asking so many questions and why we're covering every body system if possible. What you're essentially doing with this line of questioning is gathering information because while your client is talking and you're asking all these questions, you are analyzing in your mind what is the root cause for this person. You're gathering this information so that all of these puzzle pieces are coming together. You're trying to put them together so that you can answer the question, what is the obstacle to cure here? Remember, as naturopaths or other alternative practitioners, our philosophy is that the body has an innate intelligence. The body was once healthy, was born healthy. It knows what health is and it strives towards that. But if there is a lack of health, it means that something is missing in the environment or there's an obstacle in the environment, right? So for example, if they're strongly allergic to dust mites and they work in a very dusty environment, it's going to be very difficult for their body not to constantly overproduce mucus in an effort to get rid of this dust mite exposure, and therefore the person will easily catch colds and flus. Okay, so this is just a very simple example. Or similarly, uh, if the person tells you that they're extremely stressed out and they have a lot of muscle cramps and muscle stiffness and they can't sleep at night, it's easy for us to see that, they're too stressed, magnesium is being depleted in their body, and so they experience that muscle sleepiness and that lack of restful sleep. So, as naturopath, what we're trying to do is to simply remove the obstacle or provide the missing building block and letting the body's innate intelligence do the rest. So, the first visit is about gathering these puzzle pieces so that you are able to hopefully answer that question. Okay? So, at the back of your mind, all of your cogs and wheels are turning, putting that whole story together, finding that red thread, that narrative, to understand where the root cause is coming from. So you're putting the story together based on the information that they're giving you so you can answer those questions. Well, are they getting bloating and stomach pain because they have too much gluten in their diets? Do they have a massive thyroid complaint because they have amalgams in their teeth and they're mercury exposed on a daily basis? Or do they have marital problems that is creating constant stress, and that is why they are feeling anxious and depressed? Oftentimes the story is not that straightforward. There may be several root causes coming together, and some root causes are much easier to address than others, right? Uh, but that is the entire goal of your line of questioning, is to analyze what the client is telling you so that the root cause becomes clearer and clearer and clearer as the intake progresses, so that hopefully by the end of the hour and 15 minutes or hour and a half, you can explain to them what you think is the problem and you can start implementing that treatment plan. It is based on the information you have gathered. So, highlight the importance of asking the right questions to gather the right pieces of information, I'd like to share some examples from real life practice. Okay? Some things that have come out through the interview and that have drastically brought forward a new cause for why they might be feeling this way, and obviously a new red thread for our treatment plan. So I had a client once who came to me, a young woman, and she had noticed a very strange pattern to her headaches, which, by the way, she would have probably not told me about had I not asked the question of whether she observed a pattern with her headaches. Because, clients aren't really used to doctors asking these types of questions, and so either they haven't noticed a pattern or they have, but they haven't really thought that it was important. So this person told me that she only experienced the headaches on Monday morning, and she would have the headache maybe Monday and Tuesday, but inevitably Wednesday, Thursday, Friday, Saturday, and Sunday, there was no headache. All right? And so I thought that was very strange. And, then you have to ask yourself, well, what is it that this person is exposed to, right? Essentially from Tuesday to Saturday, and perhaps not really on Sunday, Monday, right? And it turns out that this client was a coffee lover. And when she was at work, she would drink 5 to 6 espressos during the day, very strong coffees, that she reports were tolerated very well. So it didn't impinge on her sleep. She didn't feel jittery or nervous. But because she had some idea that her coffee intake was excessive, she would usually not drink any coffee on Saturday and Sunday. And what was happening? Basically, by Monday, she was experiencing a withdrawal headache from the caffeine. But she hadn't quite put two and two together, because she would start drinking coffee again on Monday, but it's only really by Tuesday that the headache would go away. So she was a slow metabolizer, meaning it took her body a long time to break down the caffeine for her to experience that withdrawal effect. And so all we had to do really was to cut down her coffee intake or have her drink more coffee on the weekends. Essentially, we worked together to gradually reduce her coffee intake. So, you might think that those headaches are due to all sorts of other things, but it was really just the caffeine. Then I had another case of mysterious headaches, which also had a strange periodic pattern. And that was another young woman. She was in her 30s. And for her, it was the opposite. She noticed that she only got a headache on the weekend, but she didn't get one during the week. So that's very strange because, when people experience headaches because they are overworking during the week or staring at their computer screens for too long, it would typically disappear quite obviously on the weekend. And again, most people get enough sleep on the weekend, but not enough during the week. So that was really intriguing. So then I asked her about her diet, and it turns out that she lives here in Singapore, where I practice, and all week long she was eating at the food court of her workplace, which was a Chinese restaurant. So she was eating Chinese noodles all week, but during the weekend she was eating home cooked food. And here it's very common for many Chinese restaurants to have a lot of MSG added, monosodium glutamate, which is a flavor enhancer that many people will tolerate in small amounts but do not tolerate when they have it a lot. A lot meaning either more frequently in the week or when they have a large quantity at once, like in a soup or broth. So that was exactly what was going on with this person. She was exceeding her body's threshold for MSG during the week, and that was creating a headache. And as soon as she stopped, she must have been a fast metabolizer on the weekend. Well, no more headaches. So what we got her to do is experiment, and for 2 weeks she had to pack her own lunchbox to work and see what happened with the headaches. And sure enough, they simply vanished. So sometimes it's very straightforward. It's very easy to help people. You just need to ask the right question and really take the time to connect the dots. So these were relatively easy and straightforward cases. It really only took one visit, another one just to confirm our hypothesis, and it was fine. This one was a much more difficult one. It was a 42-year-old woman who came to me who was quite literally at her wit's end. She had visited that year many different specialists, from rheumatologists to dermatologists and GPs, because she had a whole body rash that was more concentrated on her upper body, so her arms, her face, and her chest. It looked kind of like a sunburn to me, okay? But she had seen many specialists. She came to me with such a stack of blood tests, and she was really seeking answers, to the point that she had gotten a skin biopsy done, who just showed some mild eosinophilia to the area, which they couldn't really attribute to anything. It wasn't an autoimmune disease. It wasn't eczema. It wasn't hives. It wasn't psoriasis. There was really no solution brought forward to her except to perhaps take either a steroid cream or certain immune suppressants. And she felt like neither of those were really a solution, so she was trying to dig a little bit deeper. I have to say, when I saw this rash and she, shared a little bit more of the history, it wasn't obvious to me what it might be. But she also presented with a mildly congested sinus in the morning, and she reported that everything had gotten worse since she had moved into her new apartment, or, the timelines seemed to coincide. And so I asked her more about environmental exposure, and why I did that is actually because I have had over the years a number of clients presenting with somewhat strange skin complaints, and it turned out it was due to mold exposure in the home. Which is a bit of an emerging topic. We're gradually getting more information about that. And because, her complaints seemed to coincide when she had moved in her apartment, and generally seemed better when she was away on holiday, either on a different climate or staying in a hotel or at a friend's place, I figured, well, there might be something in the home. She was ready to do anything. So I asked her to contact a mold expert who came to investigate her home. And it turns out she was sleeping in a bedroom that had wallpaper. And when they investigated the home, they found out that everywhere behind the wallpaper there was severe mold growth, to the point that the expert said he couldn't really do any remediation. The whole room and probably the whole apartment would need to be renovated. So actually, the client had been sleeping in that room, so had been spending 8 to 10 hours per 24 hours in this room being exposed to mold spores, and it was essentially an allergic reaction. But strangely enough, when she had done an IgE test at her GP's office, mold hadn't come up, and possibly because it was a different mold strain. But essentially, she sued her landlord, moved out, and everything resolved. So sometimes, we may feel a bit intimidated when clients come to us and they've already seen a whole slew of practitioners, and we really don't know, I wasn't sure here. We really don't know if we can have any value added. But sometimes through careful questioning and also as we gradually gather experience over the years, we start getting an idea of what the right questions might be, and we are able to help them, through very simple interventions. It's obviously not always the case, but it really illustrates the value of questioning and spending time with that client, getting to really know their living conditions, their diet, and so on. This is another example. This was again a 40-year-old female client. I have a lot of female clients in their 40s, and she came to me because she had a diagnosis of Graves' disease, which is basically when the thyroid is hyperfunctioning due to the presence of antibodies, which start attacking and hyperstimulating the thyroid. And I worked with this client for 3 to 4 years with everything I knew. We addressed food intolerances, we did a food intolerance test, we worked with herbs, we worked with homeopathy, and her antibodies were just through the roof. She was in the thousands, and nothing would bring them down. She had taken her doctor's medication, and then finally her thyroid was normal, but the antibodies were still very, very high. So she was able to wean off the medication, but I was quite concerned that her thyroid could relapse into that hyperfunctioning mode at any time. As long as the antibodies weren't taken care of, she was essentially not really cured. So I did a lot of research, and I was really about to say, look, I don't really know what else to do for you and just end the relationship. But that was around the time where we started having more information around mercury toxicity, like long-term toxicity versus acute toxicity. And I hadn't questioned her properly about her dental health. And so I did end up asking her, and it turned out she had 6 amalgams that had been put in her mouth when she was 12 years old. And she had been, the amalgams had been in there forever since, so essentially 20 years. So when I heard that, I sent her to a holistic dentist to get an assessment, and I asked her to do a hair test. Hair tests are not very reliable for many minerals, but WHO tells us that for many heavy metals like lead, mercury, cadmium, and arsenic, hair testing is reliable. So she sent her hair, we sent it to a lab in the US, and it turns out she had significant body burden of mercury, which you can see here, right? And in fact, she had quite a lot of heavy metal in her system altogether. This person works for a computer chip factory. So she told me she's also exposed to some of these other heavy metals like titanium and tin and silver. She said she also had some exposure to gold and aluminum in her job because she often had to go in the factory and supervise the destruction of a great number of computer chips. But for me, I still felt like the mercury was probably the most problematic part, simply because she has a thyroid problem, and mercury is well known to accumulate in the thyroid because it's similar to selenium, which the thyroid is trained to bioaccumulate. So after we did this hair test, it changed my entire treatment plan, and I understood better why I had been so stumped. And since then, we've been doing a lot of homeopathic drainage for mercury and using certain supplements to try and pull the mercury out of her system. And I'm still working on convincing her to change her fillings for something else that is not an amalgam mercury containing filling. I don't think her thyroid will get any better until that mercury exposure is totally removed. But unfortunately, sometimes, what is clear to you as a practitioner represents a significant financial and logistical challenge for your client. So in her case, it's expensive to get the fillings out, and it's painful, and she's a little bit scared of the dentist. So we're working on that. But again, you see the value of questioning, and sometimes we don't ask the right questions right away, which is what happened to me with this client. And finally, when I had this aha moment, it changed my entire treatment plan in a way that, can hopefully help her. Generally speaking, in practice, we have what is known as the therapeutic order. So in the obstacle to cure, we first absolutely want to modify diet, sleep, and stress. As long as these three are not at least somewhat optimal, it's going to be very difficult to make some headway. If all of this is more or less okay, then our supplements and herbs are generally much more useful, and same for our homeopathy. You know, if the person is constantly assaulting their body with a very poor diet, or with an allergen in their environment, or with an acutely stressed state, you know, you can throw all sorts of vitamins and herbs at them. Chances are they won't really improve. Diet, sleep, and stress are just very potent interventions. Um, Going in the mental emotional realm, I find is something that is more difficult. So usually, I first try to correct a physical imbalance before venturing further. But once the person is quite stable and I know that diet, sleep, stress, and all of that is not bad, then I will move to usually that is what I do is usually homeopathy as a mental emotional intervention, but there are many more out there. In the first visit, something that is absolutely crucial is to rule out what we call a red flag. A red flag is basically a medical state that requires your client to be seeing a conventionally trained physician because it is a critical condition that could induce permanent damage in the client's body or even might be life threatening in the long run or in the short run. So sometimes people are not aware of how severe their condition is, and instead of going to see their GP or their cardiologist or other specialists, they will come to you because they want you to use a natural intervention. And although naturopathic medicine and other alternative modalities are very effective in helping people, there are some things for which we really need our modern day conventional medicine. Okay? So, for your client's health and also for your own liability, it is very important to be able to identify red flags appropriately. And that is also why you're always carefully observing your client and asking the whole list of questions that we went over just a minute ago. All right? So basically, a person is suitable to be in your naturopathic office if their state is stable. Okay? Unstable means they have extreme shortness of breath, like they went up the flight of stairs to come to your office and they just can't catch their breath for the next 20 minutes to half an hour or more. Or maybe during questioning, they tell you that they have chest pains, but they haven't spoken to a conventionally trained doctor about that. Um, Sometimes they won't share the severity of their problem, but you can just tell that they look very unwell. They're very pale. They look like they've lost a lot of weight. Maybe they're very feverish and you can tell. Or they have some sort of wound that clearly is out of your comfort zone. You know, you're not an A&E doctor. You don't really know how to do stitches, or it looks very infected, right? Um, if they share with you in the intake that they've been losing weight without trying, this is definitely a red flag as it could indicate cancer, okay? Or if they tell you about their blood pressure, like they've been taking it at home and it's, you know, anything above 150, definitely refer. Or they bring you their annual screening test and their sugar levels are way too high and no one's done anything about that. Or maybe they're running to the bathroom with diarrhea or vomiting, they can't keep food down at all. All of this is definitely, you know, naturopathic medicine is not the right place for these things. You want them to go see a conventionally trained doctor. You want them to come back to you when they are stable. Stable doesn't mean that they're cured, okay? It means that they need to be put on a suppressive drug by their doctor for some time. Like maybe they need to take metformin for their diabetes. Once they're back on the metformin, they can come and see you, and then you can work on their diet and hopefully with their prescribing doctor to gradually pull the medication away, right? Or maybe they have a terrible skin infection. Maybe they do need that antibiotic cream and antibiotics, and then they can come back and see you so we can work on prevention, skin regeneration, scar tissue, and all of that. So if the person is not stable, they're not really meant to be in your office at this point. All right, so these are all red flags. Again, with experience, it becomes much easier to recognize. So give yourself some time. So here are some real life examples from the practice. You can give a little think as to what you would do in those situations. So this is a person that I saw. He came to me a few months ago, a 50-year-old male, and he looked quite thin, emaciated, and I noticed that he was a little bit grayish, a little bit pale. Um, and it was exactly that. He came up the flight of stairs, and I felt like he never quite caught his breath for the rest of the intake. And he told me he had been diabetic for 10 years, and just 2 years ago, he had a heart attack. And due to the heart attack, he had to have a stent placed in his heart. Okay? He was put on the standard medications by his cardiologist, so it was a beta blocker, metformin, and something to control his blood pressure. But he felt like he didn't want to be taking all these drugs. He felt like it was suppressive, that it wasn't addressing the root cause. And so he had stopped taking all his medication several months ago, and he had started replacing them with some self prescribed herbs. But he wasn't seeing any doctor anymore because he just didn't trust them, and he was fed up that they would just add drugs to his treatment plan. And because of that, he didn't really have any blood test except a very old piece of paper that was given to him 2 years ago after his heart attack with some results. And then during the intake, he also told me that he felt like his legs were very swollen, and that somehow that seemed to be correlated with his shortness of breath. So, what would you do in this situation? Of course, we agree with him. It's not great to be taking all these medications. It's definitely not addressing the root cause. He didn't change anything in his diet, despite the fact that he's diabetic, just because he didn't have the knowledge. So, would you take this client on? So, what I did is immediately an alarm bell went off in my head. Those swollen legs, that shortness of breath, and that emaciated look, the fact that he's an uncontrolled diabetic, okay, diabetes is the #1 risk factors for heart attacks, and the fact that he has a stent but had not been taking any medication to control things tells me that, he's probably having heart failure. So I referred him to a cardiologist, and poor guy, actually, he developed a clot on his stent, and he now had a ventricular clot, and he needed to have a surgery to get it removed. So definitely for me, this person didn't belong in my office at this time. Although after he'd been stabilized by his cardiologist, it would have been appropriate for us to work together on his diet, right? To try and improve his blood sugar levels. So this one definitely made me panic a little bit, and I was very glad he went to the cardiologist as recommended. This is a woman in her 40s again. She comes to me saying she's been tired, felt a bit down, she's been putting on weight. She's already seen her GP, who sent her to an endocrinologist, diagnosed with a lot of thyroid antibodies and hypothyroidism, and was put on medication. So now she's feeling better, but she hates being on medication. She really wants to figure out why she developed the thyroid problem. And she starts crying during the intake and saying that she feels depressed about all of this. You do notice that she's a little overweight. So for me, this client does not represent a red flag. She's stable. She's seen her doctor. She's been put on medication. Now our job is to work on the root cause of her hypothyroidism, maybe a food intolerance, maybe mercury exposure, maybe significant grief, right? This can definitely slow down the body. And as we work on that, to hopefully get the endocrinologist to gradually reduce her dosage of medication as we get her thyroid antibodies to come down. So this to me was not a red flag, okay? This is another one, a 45-year-old woman. She comes to me and she brings a lot of blood tests. The story is very hard to put together. I figure out she's got low thyroid function, she's medicated for it. She's had this weird tingly rash all over her back and chest and a lot of aches and pains for which she's been taking a lot of paracetamol. No one can really diagnose her with anything, but every day she's been taking paracetamol or aspirin to control those aches and pains and an antihistamine to control the rash. Everything is very muddled. But what I do notice is that she's extremely overweight, her face is puffy, and again, she's very short of breath. So I question her about that, and she says, yeah, I used to be really fit, but now I can hardly walk more than a few meters because I'm so short of breath. So when I hear that, for me, red flag. Again, heart failure, I sent her to the cardiologist, and they gave her a diuretic. And so within a few days, she lost 15 kilograms of water. And it turns out, her heart was failing for a whole slew of reasons due to her medical history. So again, for me, at this point, there was nothing I could really do for her. Once she is stabilized, she can come back and we can start working with things to tonify the heart and so on. But, in that place that she was in, no way I could have adequately treated her. Okay? And this is the last scenario that I want to present to you. 60-year-old woman. She has a long history of heartburn, gastric pain. She's had a lot of endoscopies. She has a history of ulcers, of hiatal hernia, and all of that. She's always been prescribed antacids, which she's sick of taking, but which she still uses when her stomach hurts too much. The last time she saw her gastroenterologist was 10 years ago. But now, when I question her more about the stomach pain, which has become, an everyday thing for her, she says she has to eat very slowly because she feels that stuff kind of stays stuck in her chest. She gets chest pain when she's eating. So she's very, very slowly, has to chew her food very well. And so I say, and does drinking water help you, right? Like, does it help the chest pain when you're eating slowly? And she's like, actually, no, even liquids give me that chest pain. And so that's when I felt a small shiver go down my spine, and we knew it was a red flag. If the person has difficulty swallowing solids, right, this could be due to anxiety and all of that, reflux, but if they also have difficulty swallowing liquids and a great deal of chest pain, that probably means that there's a tumor in there. And unfortunately, I sent her to the gastroenterologist. She had an endoscopy and she was diagnosed with an adenoma and had to have surgery on it. So it's surprising, even in the naturopathic office, how many people will come to you underestimating the seriousness of their condition. And your role then is, at this point, you are their primary healthcare practitioner, and you want to tell them, you need to go see a specialist or a GP or even go to A&E. And so, for example, that man who wanted to, who was diabetic and had a stent, he wanted to take herbs, and he was very disappointed that I sent him to the cardiologist, but I was very firm with him. I said, I don't want you to be taking medications, but at this point, there's just simply no choice, right? This is another interesting situation. That was a young woman, but she had probably the worst skin I had ever seen. She had a long history of eczema that had started in childhood that was so bad that steroid cream just wasn't enough. She had to use steroid cream compresses all the time. Her whole skin was raw, flaky, dry, cracked. There was no infection, but her skin was definitely very aggravated. She wanted to try and stop the cyclosporine, which is an immune suppressant, and asked me if I could help her. So for me, this was not a red flag because her skin was generally under control. She was seeing another practitioner prescribing her medication, so we worked together on a diet in particular to improve her eczema, and we did get her off the cyclosporine. Now, the first intake and every intake, you will be discussing a lot of things with your client, and it's very important to record this information. If you're in an area where your profession is regulated, you're required by law, but if you're in a place where naturopaths are not regulated, you still want to do this because it's good practice and because one day it will be regulated and you want to already be doing the right things. Also, you will discuss so many things, you will have so many patients that you need to write all this stuff down because you won't remember, and you will start confusing clients because some people just have similar profiles. And also for me, writing this information down just helps my thought process. Okay, there is a formal way to record the information. We call this charting, obviously. And so it's divided into 4 parts. The subjective part, which is everything the client is telling you, which you're recording. The objective part, which is what you yourself notice about the client, right? Like, are they short of breath? Do they look a bit pale? Do they look emaciated? Do they look overweight? Do they look upset? Assessment is essentially your diagnosis. And plan is everything that you've suggested to your client, like, reduce your intake of refined carbs, quit smoking, take this vitamin C supplement, take this homeopathic remedy, go see this acupuncturist. And you may have another section, which is future plan, which is your thoughts at this point about what you might do next visit. Because sometimes in the first intake you have all these ideas, and then when they come back, you want to try and remember that. The mnemonic for that is SOAP. This is what a SOAP form might look like. Obviously, you put the name of the client at the top. Their date of birth is a good idea as well, and the date of the visit. Then this would fill it out. So let's say very simple case, a mom brings in their baby, 12 months old baby, went to the beach, was stung by mosquitoes. The skin around the mosquito bites became puffy and red and very itchy, so now baby itches all night and can't sleep. So mom has put essential oils to the area. This is all subjective. This is what the mom has told you. So then objective, you look at the area and you say, oh yeah, the swollen area is about 2 centimeters. It's around the mosquito bite. It's on the lower left leg and there's a lot of redness and heat. So this is what you've observed. Your assessment in A, okay, it's a mild allergic reaction to a mosquito bite. Plan, put some aloe vera gel, take APs homeopathically twice a day, and if it gets really bad, put calamine and take an over-the-counter antihistamine. So this is a very simple SOAP form. In real life, when it's something more extensive than this, your subjective section may be several pages long, right? So this is just a short and brief one for you to have an idea. It's a good idea to practice on a friend or on family, to do a mock first intake or a mock follow-up intake so you can practice writing, structuring your thinking while questioning all this stuff to your clients, because it's a lot of multitasking. Remember that the chart is a legal document, so if you are ever sued, they will want to see your charting. And also your client can at all times request a chart and take a look at it. So be careful with your choices of words. You want to remain as neutral and professional as possible. So some clients can be very difficult, can have a difficult attitude, may not be compliant with what you say, and you may be inwardly perhaps a little bit annoyed with them. You don't want any of this to percolate to the chart. Your chart is a neutral professional document. It doesn't say anything about your feelings. So watch out for wording. So the things that we discussed today is how a first visit is structured and why it's important. So it's important because remember, this is your the first time that you talk to your client. You want to establish good rapport, and you also want to gather as much information as possible. And for that, your client needs to feel comfortable. So you want them to feel comfortable so they can open up to you, so you can gather all the puzzle pieces to figure out, well, what's the root cause here, right? Once you know what the root cause is, you can verbalize that to your clients. So of course, you know, if it's stress or their poor diet, you always want to say this kindly and in a sort of diplomatic manner, right? Because you want them to comply for their own good. Once you know all of this, you can put your treatment plan together and explain it to your client at the end of the first visit. So you want to practice leaving adequate time for that, because that is when clients will have a lot of questions. In the first visit, you also want to make sure there are no medical red flags. So your client's appearance tells you a lot. Are they emaciated? Are they pale? Are they short of breath? Do they look feverish? Do they look anxious and upset, right? And if there are any red flags, you want to make appropriate referrals. So you want to say, you need to see your GP, you need to go see this cardiologist, you need to go to A&E, or maybe, you know, you need to go see a dentist. I can't really help you with this tooth pain. Whatever it is, if you need the help of other practitioners, you need to disclose that to your clients. And if it's an immediate issue, you have to tell them in the first visit. Remember to chart everything that is discussed during this first visit. So remember your mnemonic SOAP. So in subjective, you write everything the patient has shared with you. Objective is everything you have noticed about the client. And also you can include any relevant information from blood test. Blood test or imaging information is considered objective. Your assessment is essentially your diagnosis and perhaps a note about prognosis. And your plan is your treatment plan. What have you told the client to do? You may also add a future plan section to just remind you next time, where is it that you want to go with this client? So I hope this 1 hour talk has put some of the elements of your printed manuals into perspective so that they can come together and giving you a little bit more direction around the first visit. It's a good idea to practice with a friend or a family member, to practice your initial introduction of yourself, explaining the first visit, practicing the questioning, practicing writing at the same time as you ask the questions, and practicing thinking at the same time that you're talking with your client. Your friend or family member may also have questions for you, and it's a great idea to practice wording the answers to the questions adequately in a way that your client understands and in a diplomatic manner. So that's it for today, and I really hope you've learned a thing or two. So see you next time.